Currently, as you can see, we have problems of insecurity. It's young people who can address those issues. We have problems facing the health sector. I tell you, in a country that has so few referral hospitals, and the available referral hospitals that we have don't have facilities. Cancer patients are dying. It is in Kenya. Pray so hard that you don't suffer from cancer. Because if you suffer from cancer, that is a death sentence. Because when you go to our largest referral hospital, Kenyatta National Hospital, you know, there are no scanning cancer machines. Radiotherapy machines have collapsed. That is an hospital now we call it a referral hospital. Go to Kenyatta National Hospital. You will see the problem facing our country. Take a patient to Kenyatta Hospital. It's like taking someone to a mortuary. Kenyatta National Hospital is now equal to a mortuary. You take a patient there with no hope that that patient will come out alive, because the conditions of that hospital will facilitate, will fast track someone who was not bound to die. Lack of medicine. It is in Kenyatta Hospital that you can find on this wing, it's a private wing. On this wing is where poor people can be taken. If you have money, you can be taken to the private wing to be treated properly. If you don't have money, you can be taken on this side of the hospital. You can do disparities. You can do discrimination in hospitals. Young people, we can't allow that to happen. Kenyatta Hospital, having two wings. The private wing, that if you have money, you can be taken there to be given specialist attention. If you don't have money, you are taken on this side where poor people are taken for treatment, where patients, 5 patients sharing the same bed, patients sleeping on the floor, where doctors, nurses don't have mercy. If they see you dying, they don't care. They have become brutal. They have become merciless. That's what is hitting the health sector in Kenya. Brace so hard, you don't get sick and be taken to Kenyatta Hospital. Making it out is a 50-50. We have a Minister of Health that doesn't work. And a hospital that cannot afford modern radiotherapy machines to scan cancer patients. The machines that you can find in the Kenyatta Hospital are those that were phased out 1980s and the 1990s. And when our patients are scanned by those machines, because they are old, they kill patients because they can emit radioactive particles to patients because they are old. They cannot perform their functions properly. So if you are a cancer patient going to Kenyatta Hospital, making it out is 50-50. Young people, we can change this situation. Look at the education sector. discrimination, inequality, and disparities. We can collect that. We can make education affordable to each and every child in our country. We can make that possible. Look at agriculture in our country. Scandals, cartels running the Ministry of Agriculture, cartels in government, a government that has drug lords who do drug business, who have become rich, a government facilitating drug lords to bring drugs in our country, that has killed many of our youths, that has made many of our youths useless. We have to say no to that. So I'm calling each and every one young person to go to leadership so that we can be able to collect this mess and make our country to work for everybody. And I know if you have mercy, if you have love for your country, you can stand up. Stand up so that we can be able to work for our country. So, my fellow young people, I'm not inciting you. I'm calling you into action. I'm telling you to stand, to talk about these problems facing our country. Young people, stand up and talk. Say your feelings. Say how you feel. Let us stand up and address these programs. As young people, let us form a think tank who can be able to discuss these problems and provide solutions to these problems. Oh, I know it's able. We are able.